Right. So today I'm going to be talking about depressive symptoms in adolescence, and just to acknowledge our funders of the Transitions RTC, NIDR, and Sabella. All right, adolescence with depression. So as we talked about just briefly a little bit, adolescence and young adulthood is a unique psychosocial developmental period, and particularly it's when career exploration activities are really taking off. It's age typical to start to get your first job, whether that's babysitting or waiting tables, and these career activities, exploration activities, have long-lasting impact on your career trajectory. And we also know that depression is common in adolescence. So about 1 in 10 have at least one depressive episode by age 14. And another statistic is about between the ages of 15 to 18, depression prevalence is about 14%. And the relapse rate is high. I think it's about 1 in 3 who have a depressive episode in adolescence will have a recurrence in later adulthood. And the effects of adolescent depression obviously are important to consider. So previous research has shown that depression or other mental illness in adolescence can negatively affect later life outcomes. So we've seen that for education attainment, low employment rates, low self-efficacy or other psychosocial traits, and also poor physical health, all related to depression in adolescence. The National Longitudinal Study of Adolescent to Adult Health has been a large data set that has been used to explore some of these issues. It's a nationally representative survey of high school students that began in 1994-95, using a stratified random sampling of United States schools. And in wave 1, about 84% of the sample is between 14 to 18-year-olds, so adolescents. And data is collected, I think, every 4 years, or 2.5 years, I think. So by wave 4, participants were between the ages of 24 to 32 years, so about 10 years between. AdHealth is another rich data set with questions on health and well-being, school performance questions, includes depressive symptoms and education employment activities. There is a parent survey component to it, so we get rich background variables on the family as well. And it's another powerful sample, or data set. Unweighted, it's about 15,700. And AdHealth used complex sampling designs to give us a lot of power. So AdHealth, people have used AdHealth to look at some questions that are interesting to us at the RTC. Previous findings do indicate that adolescent depression leads to lower employment rates in young adulthood in wave 4, also lower earnings at wave 4, and also lower education attainment. So I'm not the first to look at these kind of questions with AdHealth. But what was cool about AdHealth in wave 4, they had a lot of questions on the quality of employment. In rehabilitation services, there's often a big effort put forth to get somebody with a mental health condition employed, and less attention is paid to the quality of that employment. And we think it's an important thing to look at. What is quality of employment? Well, it's defined in several different ways. I think we were able to kind of narrow it down to really talking about the secondary labor market, which are jobs that are unstable, that offer low wages and benefits, and limit opportunities for advancement. And it's also, quality of employment is also tied to the standardization of work arrangements. So non-standard work arrangements are those part-time, short-term, or temporary employment, usually associated with low wages and low benefits, usually lacking in occupational complexity, but often have instability. And the opposite of that would be the more standard work arrangements that we think of, as most of us aim to have, where you have high or at least stable wages, good benefits, good working conditions, and also the opportunity to exert some sense of autonomy and control over your work situation. And as I kind of mentioned, we know that individuals with mental illness, there's a wealth of data out there that's mostly cross-sectional, and again, mostly with older adults with serious mental illness who are returning to the workforce. But those data do show that adults with serious mental illness, at least, often hold jobs that would fall into that secondary labor market category. Jobs that require little to no skill, jobs in the service or labor industry, jobs that are not offering benefits, jobs that are usually part-time or per diem, and usually have low occupational rankings. And the other thing we also know is that these individuals often report low satisfaction with those jobs. So we wanted to look at what is the impact of adolescent depressive symptoms on various indicators of employment quality in young adulthood. The great thing about AdHealth is, as I said, there's an opportunity to do longitudinal analysis, and there were several indicators. It was really hard for me to narrow it down, but today we're going to look specifically at the relationship of one's job in young adulthood to his or her career goals, the satisfaction an individual has with that job, whether or not that job offers health benefits, and how much of that job involves repeated tasks, kind of doing the same thing over and over again. And again, we think this is important, and it doesn't seem that anybody's really looked at this. It's something that can inform teachers, parents, and service workers when they're working with an adolescent who is experiencing high depressive symptoms. And it just really, it's important to think about keeping the focus not just on getting a job, but on career trajectories for young people. Really making sure that they're still looking ahead to what is their career trajectory going to look. And again, it's going to add to the limited longitudinal picture that we're often lacking. So again, in the AdHealth data set, depression in wave 1, again in adolescence, was measured using the CESD, the Center for Epidemiological Studies Depression, which is usually a 20-item measure. For AdHealth, they tweaked it, they dropped 2 items and added another one, so it's a 19 measure of depressive symptomatology. Means were imputed for missing items, but if more than 3 items were missing, they were excluded. And this is all based on previous literature, the people that came before me looking at this. We did cutoff measures that were different for boys and girls. So although it's a continuous variable, we collapse them into minimal, moderate, and severe. And so you'll see here that about 40% of males fall in, or 45, almost 50% of males have minimal depression, similarly moderate depression, and then less so severe. You will see in the severe depression category that the rate of severe depression is higher for females, but that relates back to the literature and what we see typically in real life. And then at wave 4, so again in young adulthood, the majority of the sample was working for pay here. So 81% of the sample was working for pay, which basically was working for 10 hours or more for 10 weeks or more. So having a job for 10 weeks at the time. And again, I'm not the first to look at this, so I just want to acknowledge the fact that there is a relationship between depression and severity in wave 1 and whether or not somebody's working for pay, and that those with severe depression are less likely to be working for pay. So for the rest of my analysis, what we did was we removed those people that aren't working for pay, and really looked, since our questions are about employment quality, they need to be working. And what we did were some bivariate and multivariate regression models predicting several indicators that I already went over. Again, limiting those to working 10 hours a week or more. And what we did is, first wave, we did bivariate, then the first multi-regression was using just the adolescent variables alone, wave 1 variables alone. And then in the second model, we did, we brought in some wave 4 variables. And Stata version 13 was used for all analyses. So the demographic data and family background data that you'll see in the regression, gender, obviously, race, white, non-Hispanic, black, non-Hispanic, Hispanic, and other. We did have an age variable, so we wanted to put that in there since there is a little bit of a range. The AdHealth Picture Vocabulary Test is essentially a measure of verbal IQ. And there was a lot of missing data there. We really wanted to try to keep as much missing data as possible. My statistician was very strong on that. So we created a variable that translates the AHPVT score into a percentile score. Maternal education and poverty level and family structure. So those are the family background variables we got. And poverty level was computed from income and household size based on the 1994 poverty level data. And family structure is basically who's living in the house with the person. And then in wave 4, the variables you'll see is there was wave 4, they did measure depression again. But this time it was a shortened version of CESD. It was a modified 10-item scale, which has been recommended to keep as a continuous variable. And then there was wave 4 education attainment, which I just wanted to briefly show how at wave 4, this is for the entire sample that were working, that most of them had some post-high school, but there were several who had gone beyond that, bachelor's or beyond. And then in wave 4, we also wanted to control for the number of hours somebody was working. Okay, so first outcome, I'm just going to show the bivariate here. So satisfaction with job. You can see again that, so we have minimal depression, moderate depression, severe depression. This purple bar is satisfied. So you can see overall most people reported being satisfied, but it seems to kind of decline a little bit with symptom severity. And especially, I think it's actually more pronounced if you look at extremely satisfied, this kind of bluish bar, that there's definitely that decline. So that the more depressed somebody was, the less extremely satisfied they were. In bivariate analyses, this was significant. Again, you have a lot of power, so a lot of things were significant. But I will say when we did do the multivariate outcomes, which I'm not going to show for this variable, this relationship did show even after controlling for wave 1 variables, controlling for some of those factors. Again, so outcome number 2, relationship to career goals. So this was a cool question, we thought, because again, we tend to think about careers. Everybody wants a career. And so this question asked, how much does this current job relate to your long-term career goals? And you can see some of the answers over here. So again, moderate, minimal to severe depression. This purple bar is, I'm working in a job in young adulthood that is part of my long-term career or working goals. And you can see again, this decline here. Furthermore, you can look at the reverse. More people with severe depression were more likely to say, I don't have long-term career goals, or that I'm not in a job that's related to my long-term career or work goals. So again, bivariate analyses, this was highly significant, and again, with wave 1 variables added into the model, I'm not going to show you that, but I can say that it did hold weight. So outcome 3 and 4, I will show you the multiple regression output. So outcome 3 was whether or not the job they had provided health insurance benefits. This is 1994, pre-ACA. We know there's a large financial need for when it comes to being treated, or just for in general, financial need is important, especially with health benefits. So here you'll see that minimal depression, moderate depression, and again, severe depression. So just slightly, those with severe depression were less likely to have or be working in a job that provided health benefits. So although it looks small, it was statistically significant. So what happens when we bring in wave 1, when we start controlling for other factors in wave 1? So here we go, race, the reference category was white. So it actually looked like those of other races were more likely to have be in a job with benefits. And the maternal background, the maternal education and family structure also played a role. Essentially, more maternal education was related to higher likelihood of having health benefits, and family structure lower, so with the different, compared to biological, living with 2 biological parents, you were less likely to be in a job that provided benefits. Most importantly though, let's look down here, that compared to minimal depression, those with severe depression were about 25% less likely to be in a job that provided health benefits. And that was statistically significant. Moderate didn't show up as statistically significant. So we can say that controlling for other wave 1 variables, the effect of having having high depressive symptoms in adolescence impacts whether or not you're going to be in a job in about 10 years that actually offers health insurance, which we know, as I covered, is a big indicator of employment quality. But then, boom, when you add in the wave 4 variables, most notably you see that education, the amount of education they obtained at that wave 4 really sucks up a lot of the significance that we had seen in wave 1. Wave 1 depression is no longer significant. Neither is poverty or PBT score. Some maternal education and family structure variables are still holding on, but you can see that when it comes to the level of education that they've achieved, that's really explaining mostly of the likelihood of being in a job with health benefits, which again isn't surprising. Wave 4 depression did not matter, and the number of hours worked slightly mattered. I thought that would be a little higher, but it didn't. So what about tasks repeatedly? So again, the question was, how often in your job are you doing tasks, the same tasks repeatedly? So again, we just hear anecdotally people, at least with contemporaneous mental health conditions, are often in these jobs where they're doing the same thing over and over again. The task complexity is low. So we see here, so minimal, moderate, severe, our purple bar here, that all or most of the time I'm doing tasks repeatedly, is highest among those with severe depression. And very few people said they were doing tasks repeatedly, none or almost none of the time, but again, you see that there is a relationship between that and depression. Again, statistically significant with bivariate analyses. So when we control for other wave 1 variables, again, we see some similarities here. So actually in this case, I didn't show gender on the last slide, it wasn't statistically significant, but in this case it was. So females are more likely to be in a job where they're doing tasks repeatedly. Excuse me. Again, maternal education and family structure, similar kind of pattern going on there. Poverty level, so again, this variable is showing that those who were living in a higher level of poverty were less likely to be in a job with repeated tasks, more likely to be in a job with repeated tasks. And here's our friend's depression here. So compared for severe and moderate, it's almost the same. They're about 20% more likely to be in a job that they are doing repeated tasks over and over again. And those were both statistically significant. And then what happens with wave 4? Similar kind of picture. So we see that wave 1 depression is no longer significant once you start controlling for wave 4 education and other variables in wave 4. So you'll see that with more education, the less likely they were to be in a job with doing repeated tasks. And again, females still held up, which is interesting. And wave 4 depression this time was showing a slight relationship there, which I think, again, that's hard to really say which direction that's going, because we know about a lot of contemporaneous work. Research will show that if you're in a job doing tasks repeatedly, you're more likely to be depressed. So what came first, the chicken or the egg, I'm not sure, but still thought that was interesting. So overall, we do see that high depressive symptoms in adolescents do seem to have an impact on quality of employment in young adulthood. I think this has implications for service workers working with adolescents in real time. Even if we just saw, I'll talk in a minute about the wave 4 education, but again, if you're working with a young adult in school, in a guidance counselor setting or some other setting, and you know that they are struggling with depression, I think it's really important for service workers to be looking beyond as much as they can to think about the long-term career trajectory and what that's going to look like. Obviously, though, we saw that the effect of adolescent depression on young adult employment outcomes is largely mediated by how much education they're acquiring. And there were some limitations here. The CESD measures depressive symptoms only, so it's not necessarily a clinical measure. I mean, it is used as a clinical measure of depression, but it's not any other measures of mental illness. High depressive symptoms are not necessarily representative of serious mental illness, and there could be other mental illnesses going on in the sample that we just weren't measuring. But I think the take-home message here, it's clear that the accumulation of human capital is very important for adolescents in general, and especially those with high depressive symptomatology. Not just in terms of having a job and getting a job in young adulthood, but also for the quality of that job. So it's clear that I have more work to do. So we're going to start exploring potentially doing some structural equation modeling to try to figure out, to tease out this trajectory. And like I said, previous people have shown that high depressive symptoms in adolescents do predict lower education attainment. So we can see the path that they're going through, but I'd like to play around with this employment quality a little bit more to see how that effect kind of